Hello everybody, my name is Jasmina Muchkanovic and this is my PowerPoint presentation. History and Causes of Parkinson's Disease. What is Parkinson's disease? Parkinson's disease, PD, is a chronic progressive disease of the nervous system, which affects a part of the brain called the basal ganglia, which is a region that regulates movement, posture, and balance. It may also affect the cortex, in which it affects thinking and remembering part of the brain. PD can also affect the autonomic nervous system, which regulates blood pressure, bowel, and the bladder. History of Parkinson's disease. In the year of 1817, James Parkinson, who was a British physician, published a book entitled An Essay on the Shaking Palsy. This book was about 6 of his patients who suffered from a slowly progress of a disease that was characterized by involuntary tremulous motion with lessened muscular power and parts not in action even when supported, with a propensity to bend their trunks forward from a walking to a running pace. Today, this disease, which was named by Parkinson as shaking palsy, is now called the Parkinson's disease. Parkinson's disease. Individuals with Parkinson's disease need high quality of care. This disease affects every racial and ethnic group. However, it is likely common in African individuals who live in Africa and Chinese individuals who reside in China. This disease is more common in men than in women and occurs in individuals over the age of 60 years of age. Symptoms of Parkinson's disease. There are many symptoms which can involve Parkinson's disease, and some of them are fatigue, muscle cramps in legs, neck and trunk, stoop posture and leaning to one side, slow movements, communication difficulties, fixed wide open eyes and drooling, swallowing difficulties, mood swings, depression, and confusion. There are many symptoms in Parkinson's disease, and sometimes it can be mistreated and not identified in time. Many individuals with the disease and with great quality of nursing care can have a great life. Symptoms of Parkinson's disease. One of the main symptoms of Parkinson's disease comes from lack of chemical substance in the brain, a specific neurotransmitter which called dopamine. Inheritance may also be a role in the development of Parkinson's disease. Some toxins such as chlorine, manganese, mercury, MPTP, which is methylphenyl tetrahydropyridine, or retinol, are linked to Parkinson's disease. Goal of treatment for Parkinson's disease. The goal of treatment is to provide an individual with best quality care to their life. In order to have the best quality of life, one must learn as much as they can about the Parkinson's disease, attend doctor appointments, and be willing to change the outcomes of their life and have faith in life. Treatment of Parkinson's disease. Many treatments can be provided to individuals with Parkinson's disease to slow their progression in time. Treatment such as dopaminergic stimulation, in which can be achieved in several ways by stimulating postsynaptic receptors, providing dopamine, decreasing breakdown of dopamine, or preventing reuptake by presynaptic receptors. Most of the medications can cause nausea and hypotension when they are first introduced in the system, or when the dose is increased. These medications can also cause hallucinations. Treatment of Parkinson's disease. Non-drug therapies such as listening, diagnosing, supporting, advising, counseling, providing equipment, adaptation to the home care environment, and exercise is used as well. Therapies such as cognitive, physical, and occupational are used in individuals with Parkinson's disease. There are many ways that an individual with Parkinson's disease can slow down the progression and time. Parkinson's disease. Parkinson's disease is a serious aspect of an individual's life. It can be hard for someone to go through it alone if they are diagnosed with the disease. The best way to help someone with the disease is to give them the best possible care that they can have, which can come from their loved ones, doctors, or nurses. Parkinson's disease seems difficult to beat because the cause is unknown. However, with future technology, the cure will come to diagnose those individuals who are suffering from the disease. Thank you. Have a great day. I hope you enjoyed my presentation.